Yeah, good afternoon. Uh, my topic is breastfeeding in low birth weight babies and sick babies. And we have been learning all through these days that breastfeeding is important for all babies to reduce the infant deaths, mortalities, and morbidities. And in these kind of babies, low birth weight babies, it is even more important, to give breastfeeding to these babies. Why it is important is that globally around 18 million low birth weight babies are born every year in the world, and although it comprises only around 14 to 15% of the total live births, but in terms of mortality, when you think of the neonatal deaths of babies, the deaths of the preterm and low birth weight babies comprises around 60 to 80%. So that's a huge number, and most of the the causes of these deaths of these low birth weight babies are attributed, in addition to the inherent peculiarities of the babies, but also to the faulty feeding techniques, not breastfeeding, and then hypothermia, and nosocomial or other infections. And these temperature irregularities, infections, and these are interrelated to the breastfeeding. So breastfeeding in these set of babies are very important. And what is the low birth weight? Less than 2.5 kg. And there are further some classifications like very low birth weight, less than 1.5 kg, and then extremely low birth weight, less than 1 kg. And what is premature birth? Preterm birth? Gestational age less than 37 completed weeks. So what would be our objectives of this session? Describe why breast milk is best food for low birth weight babies, help mother to feed her baby by a cup, and help mother to breastfeed twin babies and other sick babies. Before coming to the breastfeeding, we have this topic of essential newborn care. We all know that we have been reading this. And what are the components of essential newborn care? First is the establishment of respiration. That means the baby should cry, and if the baby doesn't cry, then we have to initiate resuscitation, timely resuscitation. And then another most important component is the maintenance of normothermia. Then early initiation and exclusive breastfeeding is the third component. Then there is the prevention of infection. The prevention of infection includes timely breastfeeding also. And then immunization, identification of danger signs and referral, and identification of congenital malformations and referral to them. And this slide we all know, this steps of hand washing. Can anyone come here and demonstrate the signs? Yeah, steps of hand washing. Yeah, sir, can you come here? Yeah.
So first is this.
Yeah. Palms and fingers. Yeah. Then
Thirds on the palm with the fingers.
Yeah.
Thirds on the base of the thumb. And this is on the palm.
Yeah.
This side, and then on the
wrist and forearm. And how long it should take? Yeah. And how long it should take?
2 minutes.
Ideally, minimum 20 seconds. It can go up to 20 seconds. Depends upon the soap consistency. If it's a liquid soap, you may finish it in 20 seconds. If it's a solid soap, it may take longer. And running water should be used. And the tape should be the elbow. Or the tape should be used. Yeah. Thank you. Need more breasts. Why these babies? These low birth weight babies, small birth. What is the small birth gestational age? Small birth gestational age means babies who are having their weight less than 10 percentile. Although they may have extra, their gestation age may be more, but their weight, if you plot according to the gestation age criteria, that may be low. If there is less than 10%, that means small for gestation age and preterm babies. So breastfeeding and low birth weight babies. So what are the advantages of breastfeeding into these low birth weight babies and small birth gestation age babies? It prevents hypothermia, hypoglycemia, and metabolic derangements. It protects against sepsis and necrotising enterocolitis, which is very common in babies, especially very low birth weight babies. And it's also due to infections. It optimizes growth and development because the growth and development. Many of these preterm and low birth babies, we need not only optimal growth, but also intact survival. That means they should come out without neuromotor disabilities and visual and hearing impairments. And we have been learning that breastfeeding optimizes gain of this mental IQ and growth and development. So breastfeeding is again more important in these aspects also, and it reduces the mortality. Yeah, what is this? This is a preterm baby being cared with a plastic sheath. This is to prevent the hypothermia. Yeah. Yeah, why is it difficult for our low birth weight babies to start breastfeeding? Yeah. Sucking and swallowing reflexes. Now, sucking is poor, and sucking and swallowing reflex is also immature. And sucking, swallowing, in addition to coordination with the breathing, is also poor in these babies. In addition to that, they also need certain essential nutrients like cysteine, essential fatty acids, and carnitine that mature breast milk cannot provide. The preterm babies, mothers who deliver preterm babies, their breast milk is rich in these substances. It can also be difficult for mother to express enough breast milk because the mother may be having some stress, and because of the premature birth that she has given. So she may be having stress, and or maybe the pregnancy might have been terminated because of the medical reasons. So it may be difficult for mother to express the breast milk also. So if you see the composition of preterm and full-term milks, the fat content is almost equal, but as I said, the protein content is more in the preterm babies, and the lactose content is less. But in term babies, it's more. So preterm milk has high protein content, which is essential for the these preterm babies. So many low birth weight babies can be breastfed without difficulty. Term babies and small birth gestation age usually suck effectively. Those babies who are term or their gestation is more, but their birth weight is low due to intrauterine growth restriction. They are more likely to establish effective and successful breastfeeding as compared to babies who are more premature. And preterm babies may have difficulty at initial phase, but if we support and give them with their effectively, they can also successfully establish breastfeeding. But breast milk can also be given by tube or cup and help to establish full feeding breastfeeding later on. So guidelines regarding the modes of feeding, how to give the feeding and when to give and how much to give. This is important in terms of these preterm and low birth weight babies. If the weight in grams and gestational age, if the baby's weight is less than 1200 grams and gestational age is less than 30 weeks, then initially these kind of babies may be having certain illnesses, respiratory disorders, and other things, maybe in sepsis. So we initially start these babies with IV fluid, and subsequently, if the baby condition permits, then we switch on to gavage feeding, that is orogastric feeding. And after 1 to 3 weeks, we put these babies on cup and spoon feeding. And cup feeding is better. And if it is okay, if the baby's weight gain is well and baby is not having any other illnesses, then we after 4 to 6 weeks, that is corresponding to around 34 weeks. We shift these babies to complete breastfeeding. And in this category of babies who are having birth weight 1200 to 1800 grams and with their gestation age 30 to 34 grams, if the baby is stable, we proceed with the gavage feeding. And after 1 to 3 days, the cup and spoon, cup is preferable. And after that, 1 to 3 weeks, we start with the breastfeeding to these babies. And babies who are more than 34 weeks, whose approximate weight would be around 1.8 kg. So initial feeding and subsequent feeding would be breastfeeding. If the breastfeeding is not satisfactory or less, we can give them the cup and spoon feeding. And in any of these group of babies, if they are tend to be weak and sometimes tired and breastfeed inadequately sometimes. So if the breastfeeding is inadequate, then we have to give them with the spoon feeds or cup feeds. If, for example, if a baby is on gavage feeding, so suppose this baby is on cup and spoon feeding, and he is not taking the cup feeding properly, then we may give the gavage feeding. And if the baby is on breastfeeding, he is not taking properly, he is not tired, amount is less, then we in between we can shift to cup feeding or even to gavage feeding. But while continuing with the gavage feeding or cup feeding, baby should be initially put to the breast to develop the nutritive non-nutritive sucking, because otherwise the baby may not develop the sucking skills and other sucking and swallowing. So initially these babies should be put on the breast to develop the non-nutritive sucking. And those babies who are on gavage feeding, means orogastric feeding, the mother may put her fingers previously cleaned in the baby's mouth to develop the sucking to the babies, so that the baby develops sucking as well as the intestinal motility is developed. So can you see what is there? There is a infant feeding tube in the stomach. How to measure the feeding tube? From tip of nose to earlobe, and then to xiphisterna. And we have to put the orogastric or the nasogastric. Generally in babies, we put the orogastric, because most of these babies may having respiratory issues, apnea, prematurity, and other respiratory distress. So this may hamper his breathing. They may be having some borderline hypoxia. So it's better to put a orogastric tube. And the amount of feeding, although it may vary, but generally it depends upon the gestational age and the weight of baby. We generally classify feeding as per less than 1500 gram and more than 1500 gram. In babies more than 1500 gram, we can start with 60 ml on day one, divided into 60 ml per kg. It is per kg per day. Okay. So 60 ml per kg per day divided into feeding can be given every 2 hourly or every 3 hourly. So we can divide that and give the baby. And on day 2, subsequent increments will be 30 ml per kg, 60, 90, 120, 150, 180, and maximum feed maybe around 1 week. It would be around 180 ml per kg. And in those babies who are less than 150 grams, the feeding is generally started at 75 ml per kg, because they have more insensible water loss in the extreme premature babies, very low birth weight babies, because their skin is more fragile. So we need to start them with the more feed or more fluid earlier. If the baby is sick, we generally start with the IV fluid and then subsequently oral feed. So this is KMC, Kangaroo Mother Care. Yeah, what are the benefits of KMC? Yes, sir. Yeah. 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 Yeah, better neurodevelopment. Most important element being is it helps in establishing early breastfeeding, prevents hypothermia, thereby preventing other illnesses. It helps in mother-child bonding, and it can be done by the father also. How to do it? In the baby has to be kept between the breast, okay, and in the intrauterine position with the legs and arms flexed and the neck tilted to one side, and when with the cloth over the baby, if the outside temperature is less. So, how to feed a baby from a cup? This is important of this session. We need to hold the baby in a. This is not a premature baby, but I think I can't find this one. Yeah, we have to hold the baby in a upright or semi-upright position with the head also supporting, and put the milk, express milk in the cup, and we have to put the cup over the lower lip, right? And touching the outer edges of the cup to the upper lip, outer part of the upper lip, and let the milk just touch the lip. Okay. And when the milk is touched at the lip, the baby baby is aroused and he becomes awake and active. He opens his mouth, and the baby takes the milk through his tongue. Is it okay? And in bigger babies, more than 36 weekers, 37 weekers, they generally tend to suck the babies, suck the breast milk. But in smaller babies, 34 weekers, 35 weekers, when we touch the glass, the cup over the lower lip, the baby, just puts her tongue out or his and takes the breast milk. Okay. And when he is, adequate with the breast milk, the baby then just refuses. Sometimes, the baby takes little, sometimes more. So we have to calculate the whole day's quantity, not just one feeding, one session. So if the whole day's quantity is less, then we need to increase the feeding. As I said earlier, if this method is less, the baby takes less, then we may put the extra milk to a gavage. For example, if the baby, after establishing this method for quite a few weeks, as I said earlier, if we started on breast milk, if the breast milk quantity is less after calculating the 24 hours breast milk, then we will, baby is not sucking well. Then we may lower this his feeding skill, means by putting on a cup and spoon. Cup, okay. By cup and spoon in the method, as compared to cup and spoon, the cup only method is better, because in cup and spoon, we need to hold the cup also, then spoon also, and also hold the baby. So it may be difficult for a mother. So cup spoon is better. Cup feeding is better. Yeah, hold the baby sitting upright or semi-upright on your lap. Hold the small cup of milk to the baby's lips and tilt it as it just reaches the baby's lips. The cup rests lightly on the baby's lower lip, and the edges of the cup touches the outer part of the baby's upper lip. The baby becomes alert and open his mouth and eyes. Lower the baby starts to take milk onto his mouth with his tongue. A full-term baby sucks the milk, spilling some part of it. So for them, we need to put a cloth around or a tissue paper around his neck, and we don't need to pour the milk into baby's mouth. Just hold the cup to his lips and let him take it himself. When he has had enough milk, he closes his mouth and will not take any more. Measure his intake over 24 hours. What is this? Yeah, this is pellet. This is another kind of cup. In order to promote lactation and enable the baby to learn sucking, all babies on gavage or katori spoon feeds should be put on the breast before each feed for 5 to 10 minutes. So as I said earlier, so before starting cup or plate, or gavage feeding, the baby need to be put on the breast nipple to develop the non-nutritive sucking, the sucking abilities. So why do babies stop milk breastfeeding when they are ill? They may have some illnesses like respiratory distress. They may be having breathing difficulty. There may be some loss of appetite due to the severe infections. or oral feed not possible due to surgical problems like tracheoesophageal fistula or cleft palate, bilateral cleft lips. These may be the reason that the babies might stop breastfeeding. Or some misinformation may be there that the illness is because of the breastfeeding, or the healthcare worker advises mother to stop breastfeeding. So we need to discourage them. Okay, so the importance of breastfeeding to a sick baby, as previously mentioned also. If the baby stops breastfeeding, the baby gets less nourishment, loses more weight, takes longer to recover, lacks the comfort of sucking, and thereby decreases breast milk, and the baby then later on refuses to start the breastfeeding. If breastfeeding continues, the baby gets enough nourishment, loses less weight, recovers more quickly, and is comforted by the sucking. So breast milk production continues, and the baby more likely to continue breastfeeding. So even during illnesses, mild illnesses, we need to continue the breastfeeding unless the baby is very sick, or with some respiratory support, or in a very sick, septic shock, etc. There we can temporarily discontinue the breastfeeding. Otherwise, we need to continue the breastfeeding even for mild illnesses. So how we judge the adequacy of breast milk? Initially the baby loses weight due to the diuresis. In term babies, it is around 7 to 8%, but preterm babies may lose up to 10% of their birth weight. And the baby, preterm baby should regain the birth weight by around 14th day. But this is not true for small birth weight and low birth weight babies who are otherwise healthy. They should not have any appreciable weight loss. They gain weight immediately because they are already mature, but their weight